Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Good afternoon once again. A recent study found that if you have wounds that don't heal well, you should ask your doctor to check your labs. It could be a sign of high blood sugars or pre-diabetes. The good news is if you get your numbers under control, there's a newer way to help in wound healing. Dr. Jon Mendelsohn here to talk about it. I know you don't use this for blood sugar problems, but you use this new wound healing how?
Yeah, we've been using it for our surgical patients, and there are some surgical patients who have higher risks, like patients who smoke perhaps, or who have diabetes, but we use it to help patients through their cosmetic surgery, their facelifts, their eyelid surgeries, and rhinoplasties mainly.
So we have just a little video of that. Tell me what it is, how it works, that kind of thing.
Yeah, it's really pretty simple. You get into this chamber. For someone who's claustrophobic, perhaps it's you know, not a great thing. But you can see Dawn here laying. It's really comfortable, actually. I'll jump in there because it's also good for cognition and neurologic activities. A lot of elite athletes may use it. So you jump into this chamber. You're at increased atmospheric pressure, delivering oxygen to your tissues. And oxygen, of course, through our blood flow is what heals us. So we do this pre-dives. We may do several dives prior to surgery. And then following surgery, there will be a series of dives as well. This may vary from patient to patient. We don't use it on everybody, but it is something that has been an adjunct to seeing diminished bruising, overall faster healing, and patients seem to enjoy it.
So I have to ask the obvious question then. You recently had your eyes lifted. Did you use it before and after?
Well, I certainly used it before because I'll jump in there in an afternoon. So I've been using it before. I did use it after. I probably used it about 6 times. And I've been traveling a little bit, but I enjoy it anyway. It's good. It's good for anybody, even if you're not having surgery. So yes, I did use it.
All right. So we have some of your before and afters, and it looked like you're still kind of healing a little bit. Tell me what's going on.
Well, so you can see there with those photos, overall, I'm doing very well. I was doing well from day one. However, I didn't follow the doctor's instructions, and I did some things I probably shouldn't have immediately following surgery. So my left eyelid, which is on the right side of your screen there, is a little more erythematous. It's a little pink. Why? Because the incision actually came open that evening. And so I needed to return Sunday morning to have it repaired again. So it's been a little delayed. But overall, it's been fantastic. Liz, I got to tell you, I was just with my brother, sister, both my brothers, their wives, friends from college. Nobody noticed I had anything done. One person said, you know, they were complaining about their own eyelids. And they said to me, geez, your eyes look good. Nobody noticed I had surgery, though, which is incredible.
Well, that's the goal. I know you said always the natural look. We want to make sure people can reach out and find you if they have questions on the eye surgery or even the hyperbaric chamber. 513-351-3223. We love your work. I'm glad you're healing well. Look forward to the follow-ups.
Thank you, Liz. Have a great day.
All right. Thanks, John.